Good evening, level 3. I'm going to take you through, as discussed, the 19 points of the hand reflexology routine. You must remember to begin your treatment with a hand and arm massage to familiarise yourself and the client with each other's touch. You then will do your solar plexus breathing to begin the treatment, as shown here. Good deep breath in and exhale. Take another deep breath in and exhale. Take one more deep breath in and exhale. Going to begin to demonstrate movement number 1, which is working the lung area. We will use our thumb walking technique for this movement. During these difficult times, we don't have clients to work on, then you are able to do this treatment on yourself, as I'm doing this evening. It's a little bit tricky, but it still gets you familiar with the points on the hand and also gets you used to doing the treatment and the order. So you can see I've repeated that 3 times along the lung area, and I've swept back and then begun again. Depending on the client positioning, you may prefer to work towards the fingers, as shown now. Movement 2 is to turn over the client's hand and repeat along the top of the hand, as shown now. Very similar to your foot routine when you're working down the top of the foot towards the lower lymphatics. So I'm gliding up, so I'm walking down, gliding up, I'm walking down and gliding up. To turn the client's hand back over, or your own hand in my case. You then are going to only perform number 3 if you're working the left palm, and that is our thumb walking over the heart, which will be repeated twice. So our heart reflex sits around here, and we are going to thumb walk over the heart area. So that's my 3 thumb walks over the heart area, which I'm going to repeat again. I'm only going to do this twice, as we would have picked up this reflex point in our lung walk as well. You then are going to do number 4, which is to thumb walk down each finger and thumb, working the sinuses. We will link straight into number 5, which is to rotate all the fingers, which will be working the ears and eye sections down to the fingers towards the wrist, and we're going to repeat those movements 3 times. So I'll show you. I'm walking down, dragging up, thumb walk down, and a nice sweep up, thumb walking down, a nice sweep up, thumb walking down, sweep up, thumb walking down, and sweep up. You're then going to rotate, slightly pull the finger there, rotate, a slight pull on the finger there, repeating each of these movements 3 times. Then then are going to do our thumb walking. We're going to glide down, always maintaining contact with your client. A little bit of effleurage in between movements is absolutely fine. We are going to work the esophagus area, which is a small section in between your thumb and index finger. You will have also seen from last week's demonstration that there is also, that it will link through to the stomach, which sits in this little sort of V section, this squashy V section here. So we will also link to a little bit, working a little section of the stomach in this movement as well. So you will come and you will thumb walk, glide down. And obviously if you're working from this way, then you will go this way. Okay. You then are going to move on to number 7, which is the thumb walk over the trapezius, which is just under the bottom of the fingers and the top of the palm, so it's this section here. Again, you're just going to thumb walk over, going to glide back nicely, nice sweeping movement, again slide back, glide back. Then from the base of the hand up towards the thumb, you are going to perform your spinal walk. This is movement number 8 on your routine. So normally you will get hold of the client's hand, a really nice demonstration on the video from last week, and you'll turn the client's hand over, tilting it slightly to the side so you can get a really good spinal walk along the edge of the thumb down to the wrist. Again, depending on the positioning of your client, which way you're going to start, which way you're going to work each area. Repeat that 3 times. You then are going to work the brain and the head by using your thumb and your index finger, pressing in and turning, going to the top, pressing in and turning. It's the head and brain section. Slight rotation as you're pressing in on those points. Alternatively, you can give your thumbs a bit of a rest here, and you can use your knuckle to repeat the same movement on those points. You'd use your other hand to support the client's hand and wrist at all times when you're performing these movements, but obviously on yourself that isn't something that we can do. So once you have finished and you've completed that treatment and you've worked each point for 5 seconds, you will then thumb walk across all the fingers and thumb from the top to the bottom, working the thyroid, throat, neck and shoulder areas. So we're just going to catch the shoulder area as we start here, and we're going to walk up, over and round each finger. going to move over to the shoulder area where we're going to do a slow creeping movement. Lots of crunching here. Okay, we are then going to use our middle and our index finger to walk over the hip and knee joint. It's on the outside here. And then we are going to turn the client's hand over to finish a little diagonal section over the top here where we are going to cover the elbow and knee section. We're going to then turn the client's hand back over. A little bit of effort to reintroduce yourself to the client's palm. You then are going to, if you are working on the client's right palm, you are going to rotate on the gallbladder. If you are working on their left palm, then you are going to rotate on the spleen. So you're going to do a little walking over the liver area. And I'm on the left hand. And then I'm going to rotate on the gallbladder. Sorry, I'm going to rotate on the spleen. I'm on the left hand. We're then going to glide down and I'm going to do my diagonal thumb walking, which is going to cover the stomach, the pancreas, the lower intestines, all of this section here. We're going to do our diagonal walking. A little bit challenging on your own hand. An alternative method, especially for the lower intestines, is a little bit of working using your knuckles just to give your thumbs a little bit of a rest there. Then going to combine 16 and 17, so your thumb walking over your bladder, walking up and over your kidney. Both of which you would repeat 3 times. You then are going to come round, you're going to thumb walk over the prostate or uterus side. Then you're going to thumb walk over the ovaries or the testes, going over the sciatic nerve to the prostate, uterus. At this point you can then revisit any areas. I'm going to go back over to the shoulder area here because that's particularly crunchy, just reworking that. Just remembering, apart from the heart, which only gets worked twice. And then you are going to complete your treatment with a lovely hand and arm massage and close the treatment with that solar plexus breathing. Taking a deep breath in and exhaling. Deep breath in and exhaling. Deep breath in and exhaling. I hope that will give you a little bit of guidance this evening through some of the routines and some of the movements that are on the routine. Please do message me if you have any queries or any questions, and enjoy practicing. And I look forward to seeing you all very soon.